Hi there, this is my video essay on socioeconomic status and health. My name is Alexandra McCanley, and this is from my Intro to Sociology class. COVID in the masses. In the article provided, there is information on how COVID affects different socioeconomic levels. In this article, there was a group of 5,700 patients in New York that were studied. Of these 5,700 patients, over 65% admitted to the hospital were insured through Medicare or Medicaid programs. Over 40% were Medicare. That is an insurance for people who are 65 years and older, and they are at higher risk for infection. And 20% was Medicaid, which is a low income option of medical insurance. The infected. There were more cases of COVID in people with pre existing health conditions. Some of those conditions were hypertension, obesity, and diabetes. These are often seen more in patients that come from lower income areas. This statistic is largely due to lack of resources such as preventative care, affordable food, and other necessary resources. There are fewer privileges and less opportunity to social distance in low income areas. An example of this would be a homeless shelter or a shelter for battered women and children. Another example is there is some low income housing that's more of like communal or group living. Families who are living with multiple extended family members in the same home. The Great Equalizer. Is COVID the Great Equalizer? There are many different viewpoints to this question. Some of the things I think are yes, COVID has affected everyone and every socioeconomic level. It's not just the poor, it's not just one race or religion or gender. Everybody in every tier or walk of life has had either themselves or somebody they know affected by COVID. Yes, COVID has not been able to be calmed in any sense. The rise of the Omicron variant, the Delta variant, the arguments on mask mandate, vaccine mandate, all of these have let COVID continue to live on. Yes, there are way more resources for those in middle and upper class than there are in the lower class. Like I stated before, having options to social distance, having big enough houses that if you are social distancing or need quarantined, you have a separate room. Um, Schools, a big thing that I have had to face in this pandemic as I am an assistant director for a daycare. And we have had to set inline policies about illness, regardless if it's COVID or non COVID. And that puts a big damper on parents, when a daycare room has to close because of an exposure. Those parents don't have any care for their children and they have to take them either elsewhere or make alternate arrangements or miss out on work, which can put a huge strain on families. Do I think COVID is a equalizer, as in it brought everybody to the same level? Not at all. I think that those in the lower class or poverty have experienced far harsher numbers. They've experienced far harsher symptoms because they can't always get the preventative care or if your insurance costs too much and you don't go to the doctor regularly and then you come down with COVID, you may not know that you have these other health issues. So no, I don't think it's an equalizer when it comes to it knocked everybody to one level, but I do think it was an equalizer in the sense that it did not discriminate in any sense. I mean, our president at the time, Donald Trump, got COVID in the office. Celebrities have had COVID, rich, poor, in between, but the severity of the situations often differ, and that is where the socioeconomic factor plays in.